Hello, welcome to our program, Inspiration from COVID-19. COVID-19 is very famous right now because it affects the world. Today's guest is Mr. Willie Wu, former Deputy Mayor of Clarington. Hi, Willie.
Yeah, good evening, Joseph. Thank you very much for having me on your program.
Okay.
And as you had mentioned,
So first of all, can you introduce yourself? Yeah.
Yes. My name is Willie Wu, and I was the Deputy Mayor and Regional Councillor here in Clarington, in the municipality of Clarington, in the regional municipality of Durham, which is the eastern gateway into the Greater Toronto Area, the GTA. And I've had the opportunity of living in this community all my life, which is basically 66 years.
Okay. So you were born there, worked there, and then retired there, right? Is that right?
Wow, that's correct. Well, really, I was born in Peterborough in 1954, and my parents moved down to the little village of Newcastle when I was a baby. They had a little restaurant, and Newcastle back at that time was about less than 800 people. Now it's about 10,000 people. Mm-hmm. Just shows you how this area is growing, and certainly this area is very diversified in different nationalities.
Okay. So while in the office as a regional councillor and also the deputy mayor, so what we do is that, do you see something like COVID-19 that hurts the community world so much?
Well, when this all first started, and apparently in Wuhan in China, and reading from the news how a lot of the Chinese businesses were suffering because people, again, unfortunately, they pin it on different ethnic nationalities, and the Chinese community was suffering not only through discrimination, but certainly with their businesses. I know the different business owners within the Toronto, Markham, within the York region area, banded together to have the taste of Asialicious, and which my wife and I attended to the Wuhan Noodle House in Markham, and some other Chinese restaurants like Lobster Part 1 to show our support to the Chinese community, but also to the business owners, and to show that this virus does not discriminate. Right now, it basically is covered globally. Mm-hmm.
Yeah, it was a China issue, now it's the world's issue. So, but as I say, in Canada, we have 3 levels of government, right? So, and the federal take up like diplomatic issue, defense, and then the provincial for healthcare. So as a municipal, so you were in the municipal level before. So how the municipal levels deal with if it happens in Clarington? How's it? I mean, the way to handle it, and any emergency committee, something like that, or?
Well, what you're seeing is, and obviously, most of your viewers would be following what's happening in Toronto when the Mayor Tory comes on, and their chief medical officer and the fire chief, when they come on, and we have followed on. In fact, in Clarington has been declared a state of emergency.
Okay.
A lot of times it seems like we are trying to support each other. I mean, it's not any one area's problem; it's all of our problem. Mm-hmm. And and obviously it's very serious. I mean, the Prime Minister comes on and speaks every day about 11:15, and then the Premier Ford comes on around about 1 o'clock. So we are following what is happening, and the events are changing day by day, hour by hour on what's happening. And when you can see how fast this COVID-19 has taken hold with a number of people that have tested positive, but also with the number of deaths that have been taking place. And we just saw the weekend in Bobcaygeon, a little community sort of northeast of Toronto, where a nursing home there, and I think unfortunately, the deaths have now reached 15 and probably are still counting. But in the municipality, we are taking our lead, obviously, from the provincial government. Municipalities are a creature of the province. And of the 444 municipalities in the province of Ontario, then there's the city of Toronto. We're trying to react the best way that we can. And you can see where Toronto and certainly our area, where we have cordoned off a lot of the parks. We've asked people to stay inside and self-isolate. Our municipal buildings, like our arenas and swimming pools, are closed. All programs at the moment are ceased. No different than the province, what they've done, and they've extended the closure of the schools. The public school system, they've ceased those, and it looks like for this whole month of April. And in my opinion, with two granddaughters in public school, one in, in fact, would be graduating grade 8. The other one is in grade 11, will be graduating into grade 12. In my opinion, I think the school year, as far as going to school, is pretty well done for at least this year.
So that will be likely closed the whole semester, right? Until maybe after fall. Then then the student lose all the study, timing, months, and how can they get back those studying?
Well, I think the government is trying to do the best that they can. It seems to be ironic that the Minister of Education had mentioned about at least 2 core curriculum courses through e-learning. I think at the end it was supposed to be optional. That was on the table. Then all of a sudden the COVID-19 or the coronavirus pandemic hit. And why I say it's ironic, it seems to be now trying to work through the different, the Ministry of Education with the different school boards to try to implement e-learning or distance learning for the for at least for now for the school year. I have a feeling it's going to be for the whole school year, unless it does subside and the teachers are willing to work into the what would be their summer holiday, which is normally July and August.
Okay. So a month ago, I have a chance to talk to the public health officer from York Region, and I asked him, is the York Region ready to take the coronavirus pandemic or outbreak at that time? So, and then his answer is that he has to wait for the provincial directives and also the money resources. Just for the York Region, he may not have enough power or resources to deal with any outbreak. And I know that the PHA Public Health Agency started after the SARS in 2003. So that is the municipal, like the mayor, handle also the health stuff, or the PHA is an individual from the normal municipal operations?
Well, you have to remember, I mean, within each, throughout Ontario, we have the hospitals, which basically under the direction of the Ministry of Health.
Yeah.
And then you look at the nursing homes, and when you were speaking to the chief medical officer for York Region, they've had some issues up in York, and especially in Markham with the nursing home.
Yeah.
And that would fall under the Ministry of Long-Term Care.
Yeah.
So a lot of that is provincially mandated, where we would come in certainly at the municipal level, like whether it's two-tier, like a regional government, local government, or the City of Toronto. You have the chief medical officer, but the chief medical officer basically doesn't really report to council, or it does report, but it really reports to the Ministry of Health.
Okay.
And so all the chief medical officers for the different areas within Ontario, they're following the guidelines of what's coming down from the province. We have our, obviously, the police, and we have our fire services. So really you have your ambulance, your emergency medical services, paramedics. So we have the first responders in that respect. And then obviously the hospitals play a very big role, and the healthcare workers.
Okay. It looks like this is quite complicated in terms of like government structure on operations. And when we look at this time's outbreak of pandemic, it looks like that the government does not respond fast, alert enough. Not like China, you look at China and say maybe one government, one order, and then everybody follow it. Here you got so many levels of operations, and then one waiting for the other. For example, like we have the shortage of the PPE, personal protective gear. I remember 3 weeks ago, the Minister of Health, Federal Minister of Health, tell us, they say we have to stock up the food, stock up the medicine. But the government did not stock up the PPE. So what's wrong with it?
Well, I think if you look at the number of personal protective equipment, or PPEs, and ventilators, I know when I was at the region, you do simulated exercises in case of emergencies. And we did have, and it still is fresh in the minds, of the SARS back in 2002. And when you look at what happened there, we do simulations. This one, again, nobody could ever predict how fast this would come. When you look at China, certainly unprecedented, where you can lock down a city like Wuhan and other areas. And I think at one time, with the total population of cities that they had locked down, you looked at probably around about 90 million. That's, or more, that's 3 times the size of Canada's population. To lock down cities, should we have shut down the border and stopped international travel? I mean, I think that's something that when this is all said and done, that they will review how they handled these crisis issues, and would they change anything? Should we even stop travel between provinces? A lot of these things I think we can second guess, but things are changing so fast. And you're right on the personal protective equipment. Sometimes, when you look at the front line worker that has to deal in those situations where other affected patients, are they equipped adequately enough? Is it reasonable to have one mask for an 8 or 12-hour shift? Is that reasonable? I guess we'll have to see, and what's going to happen is not only are you going to have those that come in that are affected with the coronavirus, but you'll have to see how many of the healthcare workers go off sick themselves.
Mm-hmm. But when we look at the figures, and I think the Canada is pretty good, right? So we got less patients and then less fatality, less deaths compared to US, compared to Italy, or the countries compared to Spain, something like that. But on the other hand, is just for a small number of patients, and it looks like that it's already putting big burden or on our health system. If for the next 2 weeks more patients comes out, and then will that crash the whole health system? How do you think?
Well, when they use this term flatten the curve or tighten the curve, what you don't want is all of a sudden you have a rush on our hospitals. And I know out in the area that I live in, Lake Ridge Health, which basically that's a unique situation where Lake Ridge Health takes in Ajax Pickering Hospital, there's Whitby Hospital, Oshawa Hospital, Bowmanville Hospital, and Port Perry Hospital. You have those hospitals, and again, any coronavirus patients are directed to two hospitals. One is Ajax Pickering and one is Oshawa, and they have a floor and bed set aside for those type of patients. But there's only so much capacity that you have in, let's say, rooms and ventilators, equipment. You can see and use the United States as an example to look at New York City. They're having to turn, bring in a boat that has over 700 beds and 1,200 staff. You have hospitals that are overflowing. You have makeshift tents that are set up to take some of the patients. Plus, you're turning different facilities into, let's say, makeshift hospitals. We're trying to at least self-assess. If you have an issue, go on the website, and worst comes to worst, where you would have to go in and be swabbed to be tested. Again, this flattening the curve, you don't want everybody coming in at once. We're hoping that we can, if the number of patients, you can moderate it so that you don't have a crush on our system, or it will overwhelm the whole planning that they have done. You'll exhaust your resources, but first of all, most importantly, you'll exhaust the staff.
I agree that, but on the other hand, it's right now the whole coronavirus or COVID-19 not only bring along the health problem, the health risks, but on the other hand also bring a lot of economic impact. Right now, the province closed down all the non-essential services, and the restaurants, the bars, they lay off most of their staff. So that it created unemployment. 1 million people apply for EI. Then I think the economic impact may be even damaging than the health issues, maybe. But how the government can take care of it? So.
Well, certainly at the municipal level, I mean, our staff and probably have followed in lockstep with other municipalities is the one big expense that people will be getting is their tax bill, the property tax bill. So, I mean, we are, and those payments are going to start coming right very soon. So we're at least postponing or deferring those payments and no interest. And, you might have some for 4 months or 6 months, whatever the municipalities choose as far as a leeway, to at least take that burden off the property tax or property owner. Now you have today being April 1st, and for a lot of people, if you're a renter, this is when you're going to pay your rent. Now, in some respects, we don't control that. If it's, let's say, a private facility, there's not much control that we have other than pleading to the landlord, and hopefully between the landlord and tenant that they can work out some arrangement where they can postpone paying the rent until their emergency salary check comes in, so that it can help pay some of those expenses. But then there's the other side. You may have a tenant that also has a mortgage on a building that they have. So we all have to work together. And I think it's been said more than once, we are all in it together, so we all have to work together. And I think the upside to some of this, I mean, I know it's a shock for a lot of people, and especially for those that find that all of a sudden they have no job because there was no work, and because of the self-isolation. You look at, we had talked earlier about the restaurants. Right now, they're allowing them to offer takeout, no dine-in. But, you know, that works on minimal staff. You don't have, you have somebody taking an order, maybe a cook, and maybe somebody else. So you have a lot of people that rely on, and most of them are probably minimum wage, and they're relying on their tips. Now they've got to be able to somehow make it through this downtime. And I think the federal government is trying to do the best that they can in making sure that there is money in people's pocket. There is an opportunity that there is relief on maybe mortgage deferrals, so that you don't have to pay your mortgage, but it's deferred for, and that's working with the big banks or mortgage lenders. You know, there's a lot of areas where we all have to, you know, come together and try to get through this tough time. And we're only going to do it if we stick together and try to help each other where we can. And I do see some of that where people have come out and said, look, if you're isolated and you're stuck in, if we have to go out and get something, can we get something for you and drop it off at your front door? I see a lot of, let's say for those first responders, the healthcare workers, that healthcare sector, where people are acknowledging the work that they are doing because they are putting themselves right in front of the pandemic. And we rely on them very much, and they deserve a great big round of applause for doing that because, like I said, my wife is a healthcare worker and she has to go into the hospital. And but there are precautions in place, and you hear that over and over again. Now it's become pretty well imposed on us that self-isolate, social distance, physical distance. Now don't go out unless it's absolutely necessary and you have to get the essentials. Even the nursing home where my father-in-law is staying, in fact, they had a shutdown. The administrator shut it down where non-essential, let's say people, which is family and friends, cannot go into the nursing home. So basically, where my wife would go in and see her father every day, or one of the family members, I should say, every day, 7 days a week, either at lunchtime or supper time or both. She can't do that, but what the administrator and staff have done is they send my wife updates on how her father's doing. And sometimes the technology, whether it be Skype or FaceTime, they would put him on so that this is some of that, I guess if you want to call it social distancing, but at least it's an opportunity to visit with him and see how he's doing.
Mm-hmm. When we look at, say, the Trudeau's packages, it looks like that it only takes care of those employees, but forget about those small business owners and those self-employed. All right. So, and also when we look at that, it looks like that you have to apply, you have to meet the criteria and get the approval, and then waiting to check for the next 10 days. So right now, if you look at everybody in Canada is being hurt, right? So, and why don't the government consider like getting a flat payment to everybody and makes the operation simple and everybody knows that it hopes that it's a temporary relief, but it looks like that if the people they get the money fast, and then they can pay the rent or pay part of the rent and then pay part from their own saving, is good. But when we look at that, you have to go to the Canada.ca, go to CRA the website and do applications. Is it too bureaucratic or too troublesome?
Well, I know it's been said, why can't we just cut somebody a check and get the money out so that you don't have that application process?
Yeah.
At one time, I guess you could go into Service Canada, and now the Service Canada employees said no, because and I can understand what's happening is people are getting
frustrated.
They're getting desperate.
Yeah.
And so, when you start getting angry at and they're only workers trying to help out, but you can only process an application so fast.
Yeah.
And when people start getting angry and start, let's say, spitting or doing whatever, you have to remember there's somebody at the other side that's only trying to do their job, no different than one of our healthcare workers.
Yeah.
They're just trying to do their job, but these are unusual circumstances, unusual times where people react differently. Some can react in a very professional or I say friendly manner, and others are very impatient. So now you have to go and apply online, and yes, you're right.
Yeah.
It does take time to process an application.
Yeah.
And that's why I think they say if you have direct deposit, the money will go into your account immediately, as opposed to if you want it mailed. So it has to go through the postal system, it has to go in your mailbox, then you got to go to the bank and deposit it, depending on the amount of money. Sometimes there's a stop payment until the check clears. So yes, there's a lot of hurdles. It would be nice for the government to be able to say, we're going to hand out checks.
Yeah.
Just like, I'd hate to be in that position where you're not the politicians, but the bureaucrats that are trying to design this system to see how it's going to work or how they're going to implement it so that it works, so that all those that, let's say, really need it, that really depend on that paycheck, get the money in a timely fashion.
I said to in my social media, I say that if you have the process like apply, verify, approve, reject, and then you'll get lots of complaints if somebody's application get rejected. All right, so why don't I just get $400 per week to everybody with an SIN? All right, so if a family of 4 members, they got $400 per person, and then they got $1,600 per week, and basically it's not enough, but at least help them pay the rent or get some food or make their mindset go peacefully, right? So now I talk to some like experts. They say does COVID-19 not only create the health problem, the jobless problem, and also the mental problem, because people are on anxiety, they feel unsafe, they feel desperate. So that could be another big issue after the COVID-19.
Well, you are very correct when you say that. These are desperate times and people are desperate. We're just getting, if you want to say, we're sort of just getting into this in this very short time, whereas in China, they had it first. Then we were reading about it in the newspaper or the media. Iran, Italy, and it really hadn't hit our shore until all those, we were reading and thinking somewhere else. I think some people here now, they're starting to feel the crunch. When you think of Friday the 13th, Friday the 13th is when they shut the schools down. And everything, and if you look at the graphs, it just seems to go up. And it's exponential increase. in the number of people that are, let's say, being tested positive where coronavirus, but also the number of deaths is just going. And you look at, and again, I'll go back to New York City. When you look at the governor, Cuomo, he's desperate, and it's just taking off in New York State, where people want to leave New York State to go to other places like Rhode Island or Massachusetts or New Jersey, and they're putting up their borders and saying, no, we don't want you. You stay in New York.
Yeah.
We hope that it doesn't happen here, that we do have healthcare professionals. We do have, our chief medical officer. We do have people that are trying to stay ahead of the curve so that in the event that there is, let's say, an increase in the number of affected, let's say, patients with COVID-19, that the medical staff, the healthcare workers are able to handle that. And that's why, again, we go back to flattening the curve, is to be able to, if they are to come in, that it is staggered as opposed to coming in all at once. But the only way that we're going to be able to sort of mitigate all of this is if we follow the rules, which, has been set out, and it keeps on saying self-isolation. Do not go out of your house unless it is for essential needs, like you have to go to buy groceries, but just go and get what you need and come home. You're not going out like it's a shopping trip and browse around the aisles and walk up and down. You go there, get what you need, get home, because what you don't want to do is, first of all, you don't want to catch the virus, but also, and sometimes too, you could be a carrier and not know it, and you could affect somebody else.
I think
so, and it does multiply, and it just shows you, like, if you and I met, I affect you, and then I've got it, you've got it, then you're going to go see other people, then you're going to spread it to them. I'm going to see other people, I'm going to spread it to them, and it just multiplies. So the best that we can do is, first of all, follow those social distancing, physical distancing, self-isolation, but also for our own protection, again, if you are out and about, when you use those disinfectant wipes, use the hand sanitizers. The best one is to wash your hands properly for 20 seconds under hot water, and don't start touching your face.
Yeah. So this is all being told in television every day by everyone. I think that the world is getting much smaller now. What happens in Asia 2 months ago, it happens in Europe last month, and then it happens in North America now. So, and also it looks like that it happens in US, maybe it will happen in Canada. Just like the cross-province traffic. Now it's stopped. You can go to Quebec unless you have a very important reasoning. So we are contained. So it's people's got contained, not the virus. So but anyway, I think it may take, some say it may take weeks or months in order to COVID-19 go away or contain it. And I think that our program called Inspiration from COVID-19. Do you have any inspiration to share with us?
Well, what I can say, and I know there's a lot of panic about what's happening, and certainly the unknown causes a lot of concerns. But as I had said earlier, what I've seen is the goodness of people, where they acknowledge the healthcare workers, and I think you've seen that on the different news media where people are putting up signs to say thank you very much, not only to the healthcare workers in the hospitals and everybody, and I'm talking about everybody, doctors, nurses, you get to the clerks, you get to the housekeeping staff, the cafeteria staff, there's a lot of people that are involved. The cleaning staff are very important in a hospital. Housekeeping. So, people, they need to be acknowledged. First responders, like, your fire, your police, your EMS, the truck drivers, those that are working and considered essential services in the grocery store, that are keeping food on the shelves or different produce so that the shelves are stocked so people need it. You're not running short. And now, I guess it's sort of, if I can say some inspiration, or I guess a lot of people, don't have to worry because they're stocked up with toilet paper. But no, on the inspiration side, if anything, I think with having to stay at home and with your family, I think that may, and I hope brings, the family, the nuclear family closer to support each other, that they understand that, yes, this is a global issue, a pandemic, but we all play a part in trying to beat it. Certainly for myself, it's probably slowed me down so that I'm not rushing around. I'm doing things around the house that probably when I was in politics for 12 years, I never had the chance to slow down and do some of my chores. And you've heard the term honey-do list. I'm working on my honey-do list, and I have no choice because I'm not running around here, there, and everywhere. I'm not going to the gym. I'm not going to visit somebody and have lunch or dinner or some of my other activities. I belong to the Masons, or I would go to these meetings. So I don't have those, extracurricular diversions. It's forcing me to stay here. Unfortunately, I guess one of the ones I miss my kids and my grandkids, my two granddaughters, but I have an opportunity to speak with them on the phone. We can FaceTime each other. So, the technology that we have still allows you to still stay in communication. I guess there's the hope that, and you have a day like today, which is April 1st, April Fool's Day, and it's such a beautiful day, and it looks like we're heading into some nice weather, that this coronavirus does not, I think, do well under hot temperatures. So, with the summer coming, hopefully at least this issue of the virus subsides, but it's not going to go away. I think what we need to do, I think it'll be a seasonal cycle because once the summer is over, then we start getting in the spring or fall and winter, the coronavirus will be back, and we're hoping that with the world coming together and trying to find a way to develop a vaccine, that we will see a vaccine that has been tested and approved so that it can be used, I guess, on the general population. So as far as inspiration, I'd like to think that when we come out of this, that, as I said, because of having this self-isolation and this and that, and finding out, obviously there's a lot of things that I didn't have to do. I can survive just in, staying together with my family and doing things around the house. I don't need to run here, there, and everywhere. I've slowed down the pace. I guess the one inspiration, too, that for this world, and I understand the pollution levels in a lot of areas, like if you look at China, they've looked at Beijing, where you'd have pollution, that you can actually see a blue sky in the sun.
Yes.
Los Angeles, same thing. So there's other areas where maybe we're giving the planet a rest, and we're not trying to strangle it.
Less car on the road, less pollution. That's correct. So
now, the one thing I will say, and I know when we talk about pollution, we talk about the amount of discarded plastic water bottles, coffee cups, straws. But and the one thing when I have you on, and if we have any listeners, what I am finding, and I had to go out yesterday to the store to get some groceries.
Mm-hmm.
And in the parking lot, I saw discarded surgical masks and latex gloves.
Yeah.
People just threw them on the ground. And, we're this month, towards the end of the month, we're going to have the Earth Hour. And we usually in Clarington have a pitch-in week where people would go out. Now that we're into the spring, the snow's melted, people would go out and pick up garbage.
Mm-hmm.
Well, when you come across items such as this, maybe the virus only lasts so long on certain items.
Mm-hmm.
But really, you have to be, we're asking volunteers to go out, and it's a community thing where you go out and pick up garbage and try to beautify your community.
Mm-hmm.
So, yes, there's a lot of garbage, but then you have garbage that's out there that really you have to be very careful. We try to provide, the gloves and the garbage bags and stuff like that so that people can do that. But when you start coming to discarded surgical masks, discarded latex gloves, it's no different than some parks you see discarded, some people's syringes.
Yes, that's correct.
Where
it's
people
dangerous.
discard.
Yeah.
So, I'd hate to use it, but, and I did go on Facebook because I took a picture of it, but you're almost going to have to shame people because people have to start taking responsibility. If somebody throws their garbage down, why is it incumbent upon me or other people to pick up their garbage? That's wrong.
Mm-hmm. Yeah, that's correct. I see your posting on Facebook, and I went out for a walk this afternoon. I see those discarded masks and some gloves. That's a good point. If people they tend to do a little bit more, throw in the garbage or wrap it in a plastic bag, and help each other, right? They help community, help the environment. But anyway, it's good to talk to you. Have your sharing tonight with us, and then we hope the virus go away pretty soon, and be safe and healthy.
Well, Joseph, it's always nice, to talk to you, and I've always considered you a good friend, and thank you very much.
Mm-hmm.
I think back to 2006, back at the Ruby Restaurant.
Yeah.
You are a great community supporter.
Mm-hmm.
I hope when this all subsides a little bit, that we could start socially interacting, that you and I can get together.
Sure, no problem. I think go out, enjoy the beautiful landscape, sunshine. All right. Okay, keep in touch right there. Okay.
Okay, will do. Thank you very much, and to all your listeners, good night, and stay well, stay safe.
I say
Bye-bye.
please be safe and healthy. Bye-bye.
Thank you. Bye-bye.